In this week's Cardiology Countdown, we will begin at the number 3 spot with a pair of papers on atrial fibrillation risk stratification. One looks at the CHADS-VASc risk score to try and evaluate risk in patients with lone AFib, i.e. those without structural heart disease that created or led to the AFib, and found that a risk score of 0 on the CHADS-VASc risk score was associated with a very low risk, just 0.19 strokes per 100 patient years of follow-up. This is now a validated score that could identify those very, very low-risk patients that had about 1/5 the risk of higher risk scores. Now, the other paper looks at the HAS-BLED score, which was developed to predict bleeding, but which the authors found also predicted cardiovascular events and stroke, as well as total mortality. And somewhat unfortunately, the risk of both bleeding and thromboembolic events goes up as the risk score goes higher and higher, although a HAS-BLED score of greater than 3 started to have greater excess risk of bleeding than stroke. Now, at the number 2 spot is a paper that looks at statins and the risk of sudden cardiac death and ventricular arrhythmias. This was a meta-analysis of 29 different studies involving over 113,000 patients. And they found no difference in the trials of statin versus placebo on the risk of ventricular tachycardia or of cardiac arrest, but did find about a 10% lower risk that was significant of sudden cardiac death. The effect on sudden cardiac death was about half that of other cardiovascular deaths. And so another insight into the benefit of statins. And at the number 1 spot is a paper published in Circulation that looks at the cost effectiveness of one of the new therapies that we're all applying, that is the TAVI, or aortic valve stent implantation. And here, David Cohen and colleagues analyzed the partner trial to see those versus medical therapy. It was about a $50,000 cost per life year saved, and about $62,000 for quality adjusted life year saved, that falls into the range of other accepted therapies that we give to our patients. And so a useful balance as this new therapy begins to roll out. So for this week's Cardiology Countdown, I'm Chris Cannon.